Are you wondering why your recent botulinum toxin injection didn't work? You could have developed resistance. Botulinum toxin injections are performed for a wide range of medical and aesthetic indications, most commonly for the treatment of dynamic facial wrinkles. However, in rare cases, patients may notice that their treatments become less and less effective over time or completely ineffective due to botulinum toxin resistance. And in this video, we'll explain how botulinum toxin resistance develops, how the antibodies form, how it is diagnosed, and what can be done about it. Botulinum toxin resistance refers to a situation where the patient no longer responds well to botulinum toxin injections even when the correct dose and injection technique are used. And patients with resistance may notice that the treatment has less effect than expected or does not work at all or wears off more quickly than usual. Botulinum toxin resistance develops from the immune system producing neutralizing antibodies that target the botulinum toxin. Antibodies are proteins produced by the immune system that recognize and neutralize foreign substances. And just like how a vaccine works with repeated injection of a viral or bacterial protein to stimulate an immune response that protects the body, repeated injections of botulinum toxin can also stimulate the immune system to produce antibodies that block the biological activity of this toxin. And several factors may increase the risk of antibody development, including frequent botulinum toxin injections, very high doses of botulinum toxin, or certain formulations of botulinum toxin that contain additional proteins. And when neutralizing antibodies develop, the toxin may no longer bind effectively to the nerve endings, reducing the clinical effect. Botulinum toxin resistance is a clinical diagnosis of exclusion, and true cases of botulinum toxin resistance in aesthetic practice is rare. Doctors will first consider other possible causes of a reduced response, such as incorrect injection placement, inadequate dosing, variation in muscular anatomy, or differences in individual metabolism. In research settings, laboratory tests can detect neutralizing antibodies, although these tests are costly and are not available in routine clinical settings. So when faced with a suspected case of botulinum toxin resistance, the first step is to attempt retreatment at a higher dosage with proper injection technique to rule out dosage or technique as a cause of the poor response. The third approach is to increase the interval between treatments or to take a treatment holiday, allowing the immune system time to reset and for neutralizing antibody levels to wane. Fortunately, true antibody-related resistance remains rare in aesthetic medicine, particularly when treatments are spaced appropriately and are administered by experienced practitioners. Botulinum toxin resistance is uncommon, but understanding how antibodies develop and how resistance is managed can help patients make informed decisions about their treatments. And if you feel your botulinum toxin treatments are becoming less effective, it's best to discuss this with an experienced doctor who can evaluate the cause and recommend the most appropriate treatment strategy. If you suspect you may have botulinum toxin resistance, come see us at Bay Aesthetics Clinic and MediSpa. Our doctors have over 20 years of combined experience and we have treated over 4,000 patients. Our treatment philosophy focuses on natural results and patient safety. Let's stay beautiful and young together at Bay.